Hi, welcome to today's episode on Fast Intelligent Care, where we're talking about basic pressure injury concepts that are good to know as a foundation when looking at pressure management. So we'll look at what are the factors that cause pressure injuries and understanding what they are, how they influence the person's body. And we'll also look at some terms like reactive hyperemia that has to do with how our body tries to compensate for pressure and how that is actually something that factors into tissue healing. And then we'll also look at understanding pressure injury terminology, so why we say pressure injury versus pressure sore or pressure ulcer, so why we've shifted to that terminology. And then we'll also explain some important pressure care principles, so things like pressure redistribution versus pressure relief. And we'll talk about things like immersion and envelopment, which is something we'll hear a lot about when we talk about support surfaces. So first, let's start with what are some of the factors that cause pressure injuries. So we have what we call internal and external factors. So when we look at internal factors, these are things that we have very little influence over. So this could be someone's age, this could be their BMI, this could be that they have diabetes, like it could be a condition that affects their circulation. So it's something that we can't really influence to that great of an extent. But then we do get external factors, and these are things that we do have control over. These are things that we can prevent or minimize or reduce or avoid. And this would be pressure, friction, shear, and microclimate. So when we talk about pressure, this is going to be a perpendicular force on the skin. So me sitting on a hard surface, my weight is going into the chair and the chair is pushing back up, and that is causing pressure on the arteries. That's going to occlude an artery. There's going to be less oxygen and nutrients getting to the tissues, and that's, or to the cells, and that's going to cause damage over time if it doesn't get that reperfusion where we're getting blood flow back to those areas. So think of it as someone taking a hose pipe and then closing up, or even twisting it or closing up the front of it so that the water is not coming out or it's not flowing. So that's pressure. Then we get friction, which is where we have the skin in contact with something. So if you think of friction, this could be someone that's sitting on a rough surface. So if you were to take a bit of sandpaper and you were to rub that on your palm, you would cause damage to the top skin layer. It's a rough surface that is causing damage to the skin. This is where we get friction. And friction is also it's kind of giving resistance to movement. This is something that we need to take into mind when we talk about shear as well, because friction and shear are usually talked about together, because the more friction there is, there's going to be more shear as well. So the way we think about shear, we can actually use the analogy of a layered cake. So think of a layered cake with jelly or like jam in between. So if you have a layered cake on a plate and you were to tip the plate to the side, because of friction, your bottom layer of cake is going to stick to the plate, but then your top layer is going to slide down. And then there's that jelly layer in between that's going to start squashing out, and it's not going to be something that you can push back into place. The cake's not going to look the same as it did before you started tipping it. And that's what's happening in the body as well. We have our skeleton that moves down with gravity. So we might be lying in the bed, we bring up our head raise. Now with gravity, the skeleton starts sliding down, the pelvis starts sliding down the bed. But think of the bottom layer of cake, that is our skin sticking to the mattress, because the mattress might be a bit grippy or have that friction. And the jelly or jam in between those two layers are, the other tissue layers, and that is getting damaged. So we're getting damage to a lot of cell structures, and unfortunately what happens when a cell gets damaged is that it spills out these contents that, or cause inflammation, if I can put it that way, the other surrounding cells, which is why like a small little bony area can cause such a big injury, because it's not just the area that's getting pressure, but the surrounding tissue are also getting damaged. Then we get microclimate, which is the levels of moisture and temperature around the skin. So think of it as a person that is sitting on a chair with a leather covering. The leather is not very breathable, and because my skin isn't able to breathe, it will heat up and I'll start sweating. So now not only is my body warm, I also have wetness or moisture on the skin, and that is making the skin more vulnerable to breakdown. Then we do have a process called reactive hyperemia. So reactive hyperemia is where our body tries to compensate for that occlusion or that decrease in circulation. It's essentially the same thing that happens when we are testing someone's blood pressure, where they actually put something that restricts the blood flow, and then as they take it off, you'll hear the blood will rush back into that area. So because of this process of reactive hyperemia, we're actually getting a short-term increase in blood flow or circulation. And reactive hyperemia is important when we start thinking of alternating air, because what's happening with alternating air is we are, for a very short period, causing some restriction in blood flow. It doesn't have to be a full cut off of the blood flow, but just a little bit. The blood vessels dilate. We then take away that pressure from those loading, offloading cycles, and then we have this increase in blood flow to the wound area. So reactive hyperemia is actually helping to heal a wound. So reactive hyperemia is why alternating air is seen as a way to treat a pressure injury. And then I mentioned in the beginning that we are moving away from using pressure ulcer and pressure sore and rather saying pressure injury. And the reason for this is that pressure ulcer and pressure sore kind of makes it feel like it's something that can just happen, like a stomach ulcer that happens when you have a certain condition. But injury is something that happens in result of something. So you get an injury when you fall out of bed. You get an injury when something hits you. That's why we want to say pressure injury, because it is something that is preventable. It is something that you don't expect to get. Like, you don't go into hospital expecting to get an injury. So the moving away from ulcer and sore is a way to kind of put responsibility on carers to understand that a pressure injury is preventable. It is something that is almost done to the person rather than something that's just bound to happen. So very important to change that terminology or the way that we talk about it. So we also want to talk about pressure redistribution versus pressure relief. We ideally want to have both. That is the best way to prevent pressure injuries. So pressure redistribution is increasing how much of our surface is in contact with the body. The more contact the chair, let's say the cushion on the mattress is in with your body, the more we're spreading the weight. So there's less pressure. So a way to think of it is, if you were to take your finger and press it into your palm, that's a small surface area, your fingertip pressing into the palm, and you're going to feel that high pressure. But if you were to take a flat hand and press that against your palm, you're not going to feel that much pressure, because we're spreading that force over the whole hand. And that's what's happening when we're sitting in a cushion that is immersive and enveloping. So this is where we get into immersion and envelopment. So immersion is sinking into, and envelopment is something contouring or wrapping around me. So if I just sink into it, so let's say I'm standing on a trampoline, that is immersion, but that trampoline's not wrapping around me. When I go in, if I step into a waterbed, or water mattress, you'll see that the mattress will wrap around the foot, and that's what we call envelopment. So this is going to increase surface contact area more than just immersion. So we want to have both. We want to have that mattress or cushion wrap around the body so there's more contact. So immersion envelopment, very important for pressure redistribution. Then when we talk about pressure relief, this is where we're offloading. So we'll talk about loading, offloading. So this is where we're getting full relief to the area that had pressure to get that reperfusion. So getting blood flow going back to the tissues. This is where weight shifting or repositioning come in, as well as alternating air. So if I have a cushion that I'm sitting on, it is going to be pressure redistributing, but I also want pressure relief, because even if I'm sitting in a cushion that is increasing surface area, I still need to give full reperfusion to my buttocks. So I want to be able to shift my weight by leaning to the side, leaning forward, getting out of the chair. If I'm in bed, I want to be turning onto different sides of my body. So I want to go from lying on my back onto my side. I don't want to just stay in one position. So we don't want to take away pressure relief, even if we do have pressure redistribution, because even low levels of pressure over a long period of time can still cause a pressure injury. It's not just high levels of pressure that cause pressure injuries. We'd love to hear from you in the comments. Let us know if any of these terms stood out to you, or if you have any cool analogies that help you to educate clients and carers on pressure injury concepts. Thank you for joining.